share my thoughts about mammograms in general and screening mammograms and diagnostic mammograms. Getting a mammogram is always an anxious experience for women, and if they happen to get a call back after a screening mammogram, it is a very, very anxious time, not knowing what they're going to find and how long it's going to take and if it's going to be anything worrisome. So I want to allay some of the fears related to that. First of all, screening mammogram is something a woman should get when she turns 40 and then yearly thereafter. Diagnostic mammograms are things that are special mammograms which are done with a radiologist present while the woman is having a mammogram, so that if something needs to be further clarified or they need to do an ultrasound or some more views and those need to be interpreted, the radiologists are there while they're doing it. What does it mean to get a call back from a screening mammogram? Well, it doesn't necessarily have to be anything bad. Keep in mind that out of all the people who get a call back for a diagnostic mammogram, only 10% eventually end up having a cancer in the breast. The 90%, the bulk of the people, will be told there's nothing abnormal in their breasts. So most of the times when people get a call back, it's because it's their first mammogram ever, or they've had mammograms in the past but they don't have them with them. In other words, they've moved but they don't have their old records, or they can't be obtained, or people who are very young or have very dense breasts. These are the people most likely to get a call back from their screening mammograms for additional views. And what exactly do they do when they have these additional views? It's mostly because a certain part of the breast was missed in the original mammogram, or there are some dense areas that need more imaging, some more compression views perhaps, or maybe they need an ultrasound to figure out if something is a cyst, which are common things to happen in the breast, or something is a solid mass. Or sometimes there are tiny specks of calcium which need to be further magnified and looked at more carefully. These are things that are done at the time of the diagnostic mammogram, and usually by the end of the diagnostic mammogram, the radiologist will come and talk to you about what they found and what they think needs to be done. The outcomes are usually of 3 different types. Number 1, they will let you know that everything looks fine and you can return to your screening mammograms every year. Number 2, if they feel that there's nothing too worrisome about the mammogram or the ultrasound, but it's not something they're quite willing to let go for a whole year, they do want a closer follow-up, they might suggest, we would like you to come back in 6 months for another mammogram maybe, or both a mammogram and ultrasound to keep an eye on something in the breast. When they do that, realize that most of the times they are not very worried about whatever they've seen in the breast tissue. But at the same time, they're being very conservative and asking you for a 6-month follow-up because they don't want to quite let it go for a whole year. And the last but not the least is when they suggest you need a biopsy. And that, being told that can be a very frightening experience. But again, realize that whenever people need biopsies, 80% of times those biopsies come back benign, meaning not cancers. But they don't know that until they have actually done the biopsy and gotten the result. So I completely get where the anxiousness is coming from, and it's valid, it's very valid. 5% of times we might find that we don't quite get the result that we like on the biopsy. In other words, the biopsy pathology doesn't quite gel with what we thought we are going to see when we looked at the imaging, whether it's the mammogram or ultrasound. That is called a discordant result. A discordant meaning the radiology and the pathology don't quite make sense when put together. And in those cases, we would recommend what's called as an excisional biopsy, which is a surgical biopsy, a removal of that tissue, complete removal of the tissue, to make sure that we're not missing a cancer there. But again, like I said, it doesn't happen very often. It's very uncommon to have that. Most of the times we get a definitive answer with our minimally invasive, either stereotactic or ultrasound guided biopsy. And then last but not the least, if it happens to be a cancer, realize that if this was detected on a screen or a diagnostic mammogram and biopsy, it is going to be an early stage and therefore completely treatable. There is reason to hope that not every time you get a call back is it going to be something bad.